Медицинский центр корпорации DENS MS
The DENS MS Corporation Center has prepared for our tools users the manual on way utilization. In this manual, the main curing methods of various diseases, the biologically active zones and points for the operating influence atlas. The present video manual must be used as an addition to the manual on electric neurostimulation. The aim of the present video manual creation to train all the users to use the DENS therapy apparatus. I consider this video manual to give a big service to all the DENS therapy users. It will bring you health.
Здоровье. Современная медицина знает.
The modern medicine obtains great knowledge about man and can do very much. The threat of horrible epidemics is far in the past. The different directions of medical science have developed. At present moment, serious operations on organ transplantation, various diseases that used to be incurable are carried out. At present moment, a blind man can return his vision with the help of modern medicine. A man after a serious road accident and inner organs injuries can recover his organism and so on. But one fact is indisputable. The 21st century medicine will take into its summary one more interesting factor – electricity. For centuries, people strived to find that energy which could be used in everyday life. With the appearance of electric energy, many tasks had been solved. All the techniques, all the daily life is based on the use of electric energy. Medicine was not left aside, and at present moment it utilizes electricity, electric energy. The first experience of electricity usage can be seen in different methods of research. Electric encephalography, cardiologaphy and so on. It is necessary to use the electric impulse as a curing method at present time. The dynamic electroneurostimulation method uses the electric impulse. Dynamic electroneurostimulation is a new method of treatment that uses electric impulse as a main curing factor that coincides the physiological neurosignal of human body in its characteristics. Thanks to it, it is possible to influence the biologically active points, biologically active zones of human organism and to achieve the regulation effect. With the help of dynamic electroneurostimulation, the organism-dependent forces are activated and directed to the pathology source elimination. The two-wrench electric neuroadaptive stimulator was created as a result of obtained clinical and experimental work experience in Moscow and Yekaterinburg clinics. The corporation new technological development favorably differs from the prototype, not only in design and ergonomics, but in advanced parameters of electric signal that is maximally close to the endogenous neurosimilar impulse with the predominance of information component. This allows to achieve the anti-stress reaction effect of training and activation. The availability of biological feedback of the apparatus respiratory allows to carry out the diagnostics of the most efficient influence zones and to fulfill individual aid to each patient in case of every disease in each concrete time period. The influence time is regulated by the organism itself in accordance with its need. As a result of the apparatus work, we achieved the synchronization of integrative relations of the organism regulator systems, thanks to local, segmental and common reactions. The tissue's reserve functional elements mobilization take place that leads in the long run to recovery of the previously damaged functional ability, and in the range of cases it also leads to the morphological integrity recovery.
Динамической электронейростимуляции посвящены
Numerous scientific works, medical conferences, scientific articles, various medical literature is devoted to the dynamic electrical neurostimulation. This method has found its application in different spheres of medicine, in hospitals, in children's hospitals, in polyclinics, in sanatoriums. But thanks to its wonderful qualities, application safety, utilizing easiness, high efficiency and dynamic electric neurostimulation is mostly applied in daily life. These apparatus are assigned first of all for utilizing in home everyday life conditions. These apparatus are home doctor. The application point of DENS therapy, so to say, the influence with the low-frequency electric signals, is the improvement of adapting-adjusting abilities of organism. In other words, the organism that given environmental conditions, take into account the inner processes taking place in the organism, begins to function better, it adapts to the given conditions better. The organism regulatory abilities increase and influence and result is better existence. The organism better functioning in the given condition in the given time. In case of respiratory organs diseases, the patient can suffer from cough, breath shortness, pain in the chest connected with breathing, where can be symptoms of weakness, indispositions, temperature rising. In case of these complaints, we begin to work as usual in case of any other problem, under any other pathology. The DENS therapy principle is the work on complaints. If a man is concerned with breath shortness, suffocation, we proceed the fishbone zone on the back, the front surface of the neck, anti-allergic zones, the zone of upper chest. In this case, the mucus appears, so the cough becomes productive, in breath improves, the suffocation stops. The criterion of the work stop is the patient's state of health improvement. Bronchial asthma is a chronic inflammatory disease of the respiratory ways accompanied by hyperactivity of bronchi and leading to the development of reversible, spontaneous or under the treatment influence bronchial obstruction. If the allergen molecule comes to the body, in most cases it happens through the lungs and react with an antibody connected with any cell. This meeting causes the whole range of phenomena in which all the lungs tissue takes intensive part. The smooth muscles of the finest bronchial ways are in the spasm statement that decreases the volume of air coming to the alveoli. As a result of this process, in case of gas exchange between blood of lungs, capillary and alveoli, less oxygen comes to the blood. The mucus laying in the inner surface of the bronchi becomes swollen and emit a large amount of bronchial secretion, because of which the air loading is partly blocked. The numerous cells producing the mucus in bronchi in normal situation are very useful, keeping the wall's elasticity, but in case of bronchial asthma fit, the secretion plugs up the respiratory ways. The mucus becomes most viscous and dense, that leads to its fluidity decrease and stopping bronchioli and bronchi. These factors explain the breathing shortening, cyanosis, wheeze and whistles while breathing, and convulsive breath-in. In case of influence by DENS and scanner apparatus, the microcirculation of blood in bronchi increases. This contributes to the bronchi smooth muscle spasm, mucous membrane swelling elimination, and the mucus outflow through the coughing reflex improvement. The method of bronchial asthma feet elimination. The fishbone zone, the conforming zone of the background direct projection of the bronchole lung tree and lungs. Operation is held in continuous mode at comfortable energetic level till the achievement of clinic dynamics, till the cough softening, mucus outflow and others. The apparatus movement speed 1 cm per second. One tries not to miss a single centimeter of skin. If there is an opportunity, it's possible to operate 2 apparatus. Then the breastbone zone is processed till 5 minutes. Continuous mode, comfortable energetic level. The upper chest zone, continuous mode is used. Minimal or comfortable energetic level. Speed 1 cm per second. The underjaw zone is processed tonsil projection. Operation is held symmetrically on both sides. The continuous mode, comfortable energetic level. Operation time 5-7 minutes. If there is a respiratory disease, the nose zone is processed. The continuous mode, comfortable energetic level, operation time 5-7 minutes. After the bronchial asthma feet elimination, the course treatment is held. Additionally, common central zones are involved, 6 points and 3 tracks. The 6-point zone points are the places of the outgo of trifacial nerve branches on the face. Operation is held in dose mode, moving the apparatus electrodes horizontally till the achievement of light sound signal. On the 3 tracks zone, operation is held in dose mode, in minimal or comfort energetic level, till the achievement of light sound signal. In case of deviations on time, on the central track, the apparatus is switched into continuous mode. Under the operation on two other symmetrical tracks, the asymmetrical zones are divided. Having found them, the operation is transferred into continuous mode, comfortable energetic level, and the operation time is 2-3 minutes. Then periphery zones are treated on the method of gloves and socks. If a man has a vascular pathology or extremity swelling, the operation is held from periphery to the center as if putting on gloves and socks. One extremity is treated in dose mode on comfortable energetic level. In case of bronchial asthma fit, when a man is alone at home, the zone can be treated on two-jog system of conformity on the palm and foot. The continuous mode, maximal energetic level. Operation is held till the statement improvement. The diseases of blood circulation organs include ischemia disease of heart, the heart inflammatory diseases, myocarditis, endocarditis, pericarditis, hypertonic disease, heart failures, the heart rhythm breakage. In case of these diseases, the patient can be bothered by the pain in the heart zone. The pain can have various character: compressing, squeezing, stinging, whining, heart-beating feeling. Headaches, dizziness, nausea can take place. In case of these symptoms appearance, the operation is held in the heart direct projection zone. It is behind the area between left shoulder blade and spine. The neck collar zone is treated taking into account the arterial pressure. The direct projection of complaint is treated. In case of headache, the place of maximal painfulness is treated. In case of hypertonic disease, when the arterial pressure rises and headaches, dizziness and nausea appear, the operation is held on the hair part of head, in direct projection, continuous mode, comfortable energetic level. The neck collar zone is treated downwards the heart zone, Sujok zone. Kidneys and aorta is treated. The operation stop criterion is the patient statement improvement. The operation is not held till the pressure normalization, but till the time when the patient feels better. The pressure can decrease later, yet 10-20 minutes the pressure can remain high when it gradually comes to the norm. Hypertonic crisis is a quick significant arterial pressure rise, causing the abrupt statement deterioration and the possibility of dangerous complication. It's usually preceded by the nervous breakdown, worrying, quarrel, exciting use. But the nervous system of a man subjected to crisis is known by its high sensitivity, excitability, and even a trifle excuse can cause the nervous breakdown. Heart and vessels react to the mood changes. The exciting brain cells transmit the alarm signal to lower structural units of the nervous system that is responsible for the heart and vessels function, and also to the inner secretion glands emitting hormones. The great role in the arterial pressure regulation belongs to catecholamines, adrenal gland hormones, adrenaline and noradrenaline. Both of them influence the heart and vessels, but in different ways. Adrenaline makes the heart contractions more frequent and strong. Noradrenaline mostly increases the little arterial tonus. Under its influence they contract, their shafts narrow. The hormones play and directly influence the arterial pressure. Under the DENS therapy influence on the human organism, the heart comes into normal rhythm, the vessels walls widen and the pressure normalize. In case of heartaches, the operation begins from the background heart projection. The area of the man's palm size is treated. The continuous mode, comfortable energetic level. Operation is held till the ache elimination. The heart side projection is treated further. The zone square is similar to the size of patient's palm. The continuous mode, comfortable energetic level, the operation is held till the ache elimination. Only in reanimation purpose, the front direct projection of heart is treated. The continuous mode, if the patient is unconscious, the operation is held on the maximal energetic level till the patient's statement improvement. The neck collar zone. The operation is held on minimal energetic level, moving apparatus with a speed of 1 cm per second. The operation time is 10-15 minutes. Further, the carotid direct projection is treated. First one determines the carotid pulsation with the help of a hand. The continuous mode, minimal energetic level, the influence time is 1-2 minutes for each zone. The Sujok zones of conformity of heart and neck collar on the wrists. The continuous mode, comfortable energetic level, operation is held till the statement improvement. While treating the hypertonic crisis, the area of kidneys and ureter is straightened. The apparatus electrodes are smoothly moved by the skin in continuous mode by comfortable energetic level on both sides. The speed is 1 cm per second. In case of lower extremities veins diseases, varicose diseases, thrombophlebitis, leibothrombitis, when a patient may be bothered by the feeling of heaviness, discomfort, pain in legs, lower extremity swelling, the operation is held upwards, in the direction of vein blood stream, from the fingertips till the talocrural joints on the feet and upwards by the shin and thigh on the line, by outer, inner and black surfaces of thigh and shin. After the apparatus treatment, it is possible to use the elastic bandaging or wearing special stockings, tights with binding effect. The lower extremities veins varicose expansion is the expansion of superficial vein accompanied by the valves unsoundness and the bloodstream breakage. To the disease development contribute pregnancy, obesity, long-standing bone weakness and junction tissue. In case of shin and thigh muscles contraction, the deep veins are squeezed and the blood from them goes to proximal parts of the vein system. The sound valves of communicant veins do not allow the blood to intrude into the superficial vein system. In case of varicose vein expansion, the vein pressure rise leads to the valves unsoundness and the communicant veins, as a result of which, under the muscle contraction, the blood under great pressure comes from the deep vein into superficial one. While the disease progresses exhaustion, the feeling of heaviness in legs, cramps and gastrocnemius appear especially in the evening and sometimes at night. The swelling usually appears in the evening, mostly after a long standing. After the night rest, the swelling absolutely disappears. In the time flowing together with the varicose expansion progress, the trophic damages appear. They mostly localized on the inner surface of the lower third of shin. In case of course influence of DENS and scanner apparatus, the microcirculation of blood improvement take place, as a result of which the valve's work improves and the blood outflow recovers. The operation of apparatus is necessary to hold before sleep. After the session, the patient shouldn't be standing. The extremities should be well bandaged. It's better to begin the treatment course from lumbar sacrum zone, 3 or 4 sessions, and then it's possible to operate on the suffering vascular direct projection. During the session, the lower extremities should be lifted. The operation is not held on the suffering vascula itself, but the soft tissue around it are treated. The area is treated upwards. Then the apparatus operates in individual dose mode on the inner, side, back and front surfaces. If there are swellings, the extremities are treated in continuous mode upwards. The speed is 1 cm per second. The underneath it is not treated. In case of arterial diseases, when a patient suffers from the pain in the extremities, the symptom of alternative lameness is typical when the pain appears while walking in case of physical loading. There may be the feeling of cold sensitivity in extremities. Legs are pale, cold, a little thinned. In case of these problems, the operation goes in the arterial blood circulation direction. So to say, in direction from the center to periphery, downwards, from ankle joint to the fingers up on feet, in direction of soak, putting off, and downwards, by thigh and shin, on the lines of outer, inner, side and the back surface of thigh and shin. Obliterating endothelius, renal diseases, hyperexia, small vasospastic disorder of arterial blood circulation of wrists and feet. The arterial vascular inner covering inflammation develops. It thickens and the artery shaft narrows. Even the whole vascular can get obliterated. This leads to blood feeding of organs and tissue breakage. As a result, they do not receive the necessary amount of oxygen and nutrient substances. Mainly the wrist fingers, feet fingers are damaged. Nose and ears and chin are damaged less frequently. These diseases are characterized by symmetrical damage with the consecutive change of skin color, paling, cyanosis, blushing. During the fit that lasts from several minutes to several hours, paresthesia, that paleness of skin, fingers freezing can be noticed. In the interfit period, the wrists are cold, cyanotic, humid. In case of DENS therapy, influence of human organism, the vascular walls widen and the blood nutrition of extremities normalizes. The treatment is better to begin from lumbar sacrum zone, when the lower extremities are treated by the apparatus. The operation begins from the lowest zone, from the ankle joint to the fingertips. The mode is continuous, energetic level is minimal or comfortable. Each zone is treated during 1-2 minutes. Each leg is treated consequently and from all the sides. The treatment level rises with each session. The operation begins from radiocarpal joint till the fingertips, continuous mode, comfortable or minimal energetic level. Each zone is treated during 1-2 minutes. Each hand is treated consequently and from all sides. The treatment level rises with each session. In case of digestion organs diseases, the patient may be subjected to the pains in stomach, and the pain is often connected with the food consumption. It may appear when stomach is empty or sometimes after the food consumption. The main rule of DENS influence is the operation on complaint. In other words, where it hurts, there the apparatus should be put. In continuous mode, on comfortable energetic level, the maximal painfulness place is treated. In case of stomach and duodenum ulcer diseases, the pain is usually localized in the upper parts of stomach. In case of such complaints, the epigastrial area is treated till the pain eliminates. The stomach